So this is little Sherbert. She's standing in to show y'all how we do a physical exam on all of our patients before they go to surgery. So we're gonna check out her little teethies. Oh, she says she doesn't want to, but we're gonna do it anyway. And we're just looking to make sure she has good color and she's well hydrated. And we check our eyes because kitties have really high blood pressure. Sometimes these decils will be kind of funny looking, and we will make sure that's all good before we go to surgery. And just for the fun of it, we look in ears because it's part of every physical exam. Sherbert says this is not fun. Not fun at all. Oh, and they look beautiful. Then for the good part, we're going to listen to her heart and lungs because we want to make sure she's plenty healthy to undergo her little anesthesia. She sounds great. Her lungs are good and clear. Her heart rate and rhythm is very good. Her tummy feels good. And oddly, we're talking about a surgery today that we do to boy cats. And most of these beautiful orange kitties are boys, but she is actually a girl. So she is truly a stand-in. The surgery we're talking about doing today, we actually will, if we were a boy kitty, will remove their penis. It sounds kind of aggressive, and actually it is, but what it does is help prevent them from getting blocked by stones or mucus or plugs in their urethras. So boy kitties' urethras get really, really narrow right past the end of their penis as it's going into their body, and they tend to want to block there. So we do this little surgery that we kind of turn a boy kitty into a girl kitty. Instead of peeing out the back side of their booty or spraying a wall, they can then urinate freely, very similar to a female kitty, and it reduces their chances of getting blocked by about 90%. That surgery is a perineal urethrostomy, commonly called a PU, just because that's a lot of words to say. We use a caudal nerve block, an epidural in these guys to make sure everything back there is pretty pain-free. We make an incision along the base of the scrotum and around where the penis and prepusole is attached there. Remove all the subcutaneous tissues, and then we get to the kind of nitty-gritty here, removing some ligaments and muscle attachments to free that urethra up. Kitties have lots of muscles back there so they can spray urine, and the wild male adult cats like to spray, so they have to have good muscle control. After we do this procedure, they don't need any of that, so we have to make sure all those little muscles are broken down by their attachments to the pelvis. Then the urethra is isolated and kind of opened up and sutured to the outside, leaving a kind of drain board effect there where the urine can be expressed from the bladder, and instead of having to go through that penis in that small opening, it comes down that little drain board. Then the tip of the penis is actually removed, and you have urethral tissue attached to their little tummies. We double check and make sure the opening is large enough. A couple of different ways to do that. There's a little catheter placement that should go through easily, and then a little surgical instrument that should slip down in there nicely. So we check that out very well. Close all this up with tiny little suture material that requires magnification in my behalf, and then it is all done.